Hi, I'm Dr. Song. In 1995, I incorporated orthodontics into my general dental practice in San Diego. I found orthodontics to be so rewarding both professionally and personally. Today, my practice is limited to 100% orthodontics. So at this time, let me briefly share with you 3 sample ortho cases I've treated over the years. The first case is Lance, age 14, looking at his teeth, his occlusion. And these are some of the keys in what makes a good ortho case. First of all, his right and left side, his bite matches. The molars, premolars, it matches. He's crowded, cuspid blocked out. However, he does not have an open bite. So this is what makes a good case. Symmetry, no open bite, crowding with the teeth toward inward a bit. So we place brackets, and we placed a very gentle thermal nickel titanium wire. So no pain, and if you can do a facial composite, putting on brackets, it's 100 times easier. No shots, no blood, no prep. You just bond the brackets on, and then very gentle thermal nickel titanium wire. And over time, in a matter of 4 to 5 months, we can go from crowding to straighten out the teeth without any extractions and much difficulty. After I get the upper arch straight, then we bracket the lowers. We get the upper teeth out of the way, then I bracket the lower arch, again a very gentle wire, and we go from gentle wire to gradually increasing the strength to a little bit stiffer wire. Finally, when we have both an upper and lower arches coordinated, fairly straight, our final correction is getting the teeth to fit in. So we add rubber bands, both sides, to get the premolars, molars, cuspids, everything to fit in properly. So this case took about 15 months, and just gentle wire, leveling, aligning. Get the upper arch set. The key is getting the upper arch to a proper arch form, and once the upper teeth are out of the way, we bracket the lower arch, get them straightened out. Once the lower arch is fairly straight, some elastics, rubber bands to get the teeth to fit. And in about 15 months, the case was done. So here are the photos before and after. Midlines are on. The cuspid that was blocked out is in. So orthodontics with the new technology is much simpler. Very little wire bending. It's a much more simple process. The second case, this is Matthew, age 13 and a half years old. Huge overjet. 14 millimeters of overjet. Class 2 molars, class 2 cuspids. We could check it cephalometrically with the x-rays. Huge overjet. So we bracket the upper arch. We need to widen the upper arch first. Make it V into a U. Go from a gentle wire to heavier wires, and we, in about, again, 3 to 4 or 5 months, we got the upper arch into a nice U shape. After we get the upper arch bracketed and nice shaped, we bracket the lower arch. Then we started on some class 2 elastic. Class 2 elastics is rubber bands from the upper cuspid to the lower molars. This is to train his jaw to come forward, to posture his jaw forward. And like most teenage boys, we had some compliance issues, poor hygiene, and he did not wear the rubber bands very well. So the next step for him, we added a composite bite ramp. This forced him to posture his jaw forward. So that holds his jaw forward. He plays football, so he knocked off some old composite restorations. But anyways, we have the composite bite ramp, and the final step is getting his teeth to meet, to intercuspate. So he wore elastics. Now he's motivated to wear the elastics because he wants to get done. He wants to get the braces off, and especially the bite ramp off. So he wore the elastics to get the bite to fit in. So this case took about a year and a half, 18 to 20 months, because we had some compliance issues. So first we get the upper arch straight. Then we get the lower arch straight, class 2 elastics, which he did not wear very well. We had the bite ramp, some vertical up and down elastics. We made him a little special retainer for the bite to settle in. The bite settled in very nicely, and he got some restorations done, and that's how the bite settled in. So this is the retainer with a little bite ramp to help his jaw stay forward. Here he is wearing the bite ramp. So you can see the bony changes from a severe class 2 div 1 14 millimeter overjet to a much more natural, appropriate profile for him. tremendous change in his facial profile. And from the facial aspect, what a great service to our patients we can do for them this way. The last case I'd like to share with you is my youngest patient ever, 4 years old, Sally. Severe anterior crossbite. So for Sally, we made her a little sagittal expander. Here's a key. If they lose that, a paper clip will work. They put it in the hole and they turn it in the direction of the arrow, a little quarter turn. They activate it once a week. And here she is wearing the sagittal expander. So mom turns the key once a week. And in about 6 to 8 months, it's maxed out. So the premaxilla got pushed forward. Of course, she developed a little bit of an open bite in the back. So we made her a retainer with a Holly biplane to hold her jaw forward to give her a little resting place. And children 4 or 5 years old, the bone remodels very quickly. The teeth erupt very quickly. So here's the time lapse on this case. So this case took about a year. This phase 1 treatment ortho took about a year. About 8-10 months with the sagittal expander, and then the Holly with a bite ramp that settled her bite in. So here she is. Now has a chance to grow properly. So orthodontic economics. The average ortho case, full ortho treatment is about $5,400. Material, braces, wires, retainers, roughly $400. So the $5,000 is all chair time. It's just office time, labor. So ortho, if done properly and efficiently, is very profitable. It is fun and profitable. I tell my sons, talent is good. Talent gives you a head start. Practice, you have to practice to get better. And what makes you the best is passion. Orthodontics, incorporating orthodontics, reinvigorated my passion for dentistry. It makes me a better clinician. Again, it brings fun and profit to our practice. So I highly recommend you learn about ortho, incorporate into your practice. For more information, my sponsor is Lancer Orthodontics. This is their 800 number, 800-854-2896, or go to my website, jinsongdds.com. So I really appreciate your time here watching the video clip, and thank you very much.
Thank you.